my clinic for 25 years. They come in, I hug them, kiss them, whatever. Like, it is, now I know that most of this is crap. But at a time when we didn't know anything, when infection control was a fledgling science, this is probably not a bad way to have gone. In 2006, dentistry is still transmitting viruses. In America, an oral surgery practice, several patients got hepatitis B, and to this day we don't know what caused that. All of this means that this is a relatively new science. In 1992, the committee that I speak about, that I was chair of and vice chair and now past chair, it was developed in 1992. That was the first time the Australian Dental Association got an infection control committee. And at the time, we based our overall principles on what was the CDNA, the Department of Health and Ageing, what we called the Blue Book, which was infection control in an office setting. For instrument processing, 4187 was the Australian standard, and a lot of people assumed that 4187 was the infection control manual. That's not true. 4187, the Australian standards, 4187 and 4815, they are standards for instrument reprocessing only. They are not guidelines for infection control. They're an important part of it, but they are not the whole thing. So, what are the requirements then? Now we get on to the actual lecture. What has changed and what do you have to do? Well, the first thing is, and this lecture will be available, I think, John's going to make it in a PDF form for anyone who wants to get these details afterwards. Pardon me. The dental board can be accessed on www.dentalboard, etc. And it requires all dental operators or practices to have 4 guidelines. They require you to do a protocol manual, which is what I was up here today working a little bit on, a protocol manual. They require you to have one of the 2 standards, 4815 or 4187, for your instrument reprocessing. They require you to have the NH&MRC guidelines, which are available online. And they require you to have the current Australian Dental Association infection control guidelines. That's the federal infection control guidelines. For a protocol manual, what do you do? Most of the time I like people to make one themselves, and that's what we were, because you need to put in all the nuances as to who's going to do what and where, what sort of practice you've got. The protocols for an orthodontic practice will vary from a restorative practice, which will vary from an oral surgery practice, okay? Each has its own flow problems. So developing your own is good, but if you don't want to, you can always flog the ADA Victorian branch's standard operating procedures off the web. ADA Queensland put out an infection control disc, which is likewise very good, or you could use a template from one of the private infection control companies. The current and updated guidelines that you are required to have, the ADA has had a new revision done. It has just been sent up to the ADA executive. It has been passed by the Infection Control Committee. Is it very much different from the previous version, which was finished in 2008? Not really, but I'll highlight the differences in a minute. The NH&MRC guidelines were revised and published in 2010. AS4187 is in revision, and I would advise people not to buy it until the new one comes out. AS4815 may pass into disuse. It may disappear. It hasn't been updated since 2006, and Australian standards is having trouble getting people to support it. Currently, that's the yellow book there, that's 4187 actually. The 4815 is for office practice and is more applicable to office practice, but many of you for instrument reprocessing may have to revert to using 4187. Look, the differences are not huge, okay? Instrument reprocessing, if you go, I was talking to Robin earlier, if you go according to the Queensland CRISP guidelines, that pretty much sums it up, and that works with either of these documents very well. This, however, is for all of health, all of environment. It's about hand hygiene, it's about what diseases you can catch. It pretty much covers all sorts of things. It's an evidence-based document. Now, evidence-based documents are a little bit of a problem. For example, the evidence is rated according to how valuable it is. And in medical terminology, the clinical trial gets the biggest rating. Well, you can't do a clinical trial on reprocessing of instruments. You can't say, well, this clinic, your clinic, will have instruments that we're not going to do anything to except put them through a dishwasher, and your clinic will have full-on sterilisation and validation and monitoring and all that sort of stuff. Because you guys who don't sterilise them, you're going to get sued. And it's like someone who's up in a plane and they're going to jump out of a plane and they say, well, is there a clinical trial as to whether a parachute's good or not? The guy's going to say, give me a parachute, all right? It's the same here. They're going to say, sterilise the instruments, because we cannot do a clinical trial. There are some things in infection control that cannot have clinical trials. Apart from that, there are other things that have been proven to be very effective, and one of those is in the area of hand decontamination. This is where you can get that free download, and you can either print it if you've got enough paper to print it. It's a fairly hefty document. You could have got one bound like I did if you sat on the committee, but it's a bit late for that. They only printed about 30 copies, so the rest of it is all done online. It's written quite nicely. It's an easy book to read. You can pick out the parts you don't want to read. There's a whole lot of stuff on nosocomial infections like MRSA and VRE, and Clostridium difficile. Now, if that ever gets to be a problem in dental practice, then we have real issues, trust me. So there's a lot of things that maybe not specific. You can just skim the pages when it gets too medical, but a lot of it is good stuff. In particular, you can go to the part where they've got posters, and you can actually print these out. So if we get another swine flu and you want people to decontaminate their hands, you can actually print this out for visitors to your practice, telling them what you want them to do. So there's a range of things in there that can be quite useful. All right, on to the ADA guidelines for infection control. These have been developed over... Well, the committee's been running since 1992, not quite 20 years. We only made the guidelines in 2008. That's the first time the committee wrote specific guidelines for dentistry. And we wrote specific guidelines for dentistry because we got sick of people saying, you haven't done something according to standard 4815, when they were talking about a clinical area. You know, like 4815 has no application in a dental surgery. It belongs in the sterilisation room. So we decided, okay, we need specific guidelines for dentistry. We know what we're talking about. A court of law will know what we're talking about. So This document is relatively easy to read, and anyone who is an operator, and that includes students, should read this guideline. All right? Anyone who is the practitioner is going to be responsible for anything that goes wrong, and that includes students. Not your tutor, not the university. If you don't do things according to the correct procedures, then you are the one who will be dragged before the dental board. You are the one who will be investigated. You are the one who will be told that you've got limitations on your practice until you get your infection control right. So everyone who is a practitioner should read this document. Now, our support staff, I don't think we could practice infection control and see patients if we didn't have good support staff. In fact, one of the reasons today that my main focus has been to work with the infection control manager in terms of getting this done. Because getting a dentist to put together a protocol doesn't really work very well. You want someone on the cutting edge who sees what is happening, who sees how things should be cleaned, who sees how things should be packed up, who sees how things should flow. And the most appropriate person to do that, believe it or not, I believe is the dental assistant. However, having delegated your infection control management does not get rid of the responsibility. If the management fouls up, the person who's going to be responsible is the person who was working on the patient when the foul up occurred. Does everyone sort of get that? All right. You can be owned by Queensland Health, you can be owned by a dentist, you can be owned by a